Good morning, I'm Joellen with Insurance Professionals, here to discuss your insurance plans with Page One Power. You have the first option available is going to be a health savings account. It's going to be very important that you go in-network. There's an in-network benefit and an out-of-network benefit. The network providers can be found at www.aetna.com/ASA. So it's aetna.com/ASA. So the in-network deductible is $1,500 for an individual. It's $3,000 combined deductible for all family members. Out of network, the individual deductible would be $3,000, and the family deductible would be $6,000. So you see, it's very important to go in network if you want to save money. After you meet the deductible, the insurance company is going to pay 80% of your co-insurance in network and 60% out of network, until an individual reaches a total of $6,000. That $6,000 does include the $1,500 deductible. The family out-of-pocket is twice the individual at $12,000. The plan benefits do include 100% coverage for all preventive services. And preventive services are part of the Affordable Care Act, includes your annual exams, wellness, pediatrician checks. There's a list of it that's going to be available to you on your website. Physicians and specialist office visits are going to be applied towards your deductible and co-insurance. Your outpatient diagnostic x-ray and lab is also going to be paid at deductible and co-insurance. You do have a program called Quest Diagnostics, which will cover 100% of your diagnostics if you have the provider send those services to Quest Diagnostics. Outpatient diagnostic imaging services, which include but not limited to CT scans, MRIs, and PET scans, are deductible and co-insurance. Your prescription benefits are also deductible and co-insurance. You're kind of getting the feel that everything on an HSA is applied towards deductible and co-insurance? That's correct. Emergency room services, urgent care, outpatient care, all deductible and co-insurance. You do have manipulative therapy, which is chiropractic services. That gives you 20 visits, but it's still applied towards your deductible and co-insurance. This benefit does include benefits for occupational, speech, and physical therapies. You're limited to 60 visits per calendar year. Acupuncture, massage therapy, and naturopathic medicine, you're limited to 12 visits per calendar year, all applied towards your deductible and co-insurance. There is nutritional counseling available as well. You get 3 visits, while covered under this plan. It does not limit or apply to diabetic counseling. Chronic pain management treatment program, you have 10 visits per calendar year, and that is applied towards deductible and co-insurance. There is mental illness, nervous disorders, substance abuse, and alcohol abuse. Its covered charges are paid the same as any other services on this plan, which is deductible and co-insurance. There's private duty nursing care, prosthetics and durable medical equipment. Skilled nursing care is limited to 81 visits per calendar year. Home health care has 100 days per calendar year. And ambulance services are covered, all under deductible and co-insurance. We do have organ transplants available. It's at a designated transplant facility. It does apply towards your deductible, then it's covered at 100%. Pre-certification is required on this plan if you're going to be going in for inpatient rehabilitation, skilled nursing, behavioral health residential treatment, hospice care, or high-tech imaging services like CAT scans, MRIs, PET scans. There's a $300 penalty if you do not pre-authorize. Most of the times your doctors pre-authorize for you, just make sure that they do. There is no lifetime maximum for the essential health benefits as designed by the Affordable Care Act. There are reasonable and customary fees on this plan for out-of-network services. It's all contracted pricing in network. And that's a $40 copay on the health savings account plan. There is coverage on this plan for domestic partners if that is a necessary issue in your household.